part of the mission of the Red Cross is to support vulnerable persons. The migrant population here in Icacos is a little bit more vulnerable because they have limited livelihood because of the COVID pandemic, but more so they have access to limited or no water at all for prolonged periods of time. For the most part, they rely on the sea, salt water, or groundwater that they dig in an improvised well. So water sanitation and hygiene promotion is a culture change program. Generally, we have populations that have limited access to water, so they have generally developed poor hygiene practices. So through our participatory hygiene and sanitation training, PHAST training, we're here to work with the community to help build their capacities and improve their hygiene. So what we've been doing is we've been providing access to water, improving the access to water.
The work that has been done here today is of fundamental importance to the European Union. We wish to have our values communicated worldwide. It's a part of the policy of the European Union never to forget a people or a crisis.
My work resides in social development issues. I work mainly with civil society organizations to implement our human rights strategy as well as our programs in partnership and development partnership with Trinidad and Tobago. We partnered with the Red Cross for a number of reasons. One, because we like to work with civil society organizations who are already on the ground, understanding and knowing the communities and working in the communities. And secondly, because we know the work of the Red Cross internationally as well as locally.
I've always been aware of the good deeds of the Red Cross. I think it's an extremely noble organisation. The Red Cross holds a very special place in my heart because in my own family situation, my father was actually a captured prisoner of war, and it was due to the Red Cross that he was traced. My grandparents were then told that he was alive. Migrants are enormously vulnerable, and here we are reducing that vulnerability by enabling them to have access to facilities and working to have self-empowerment, for example, by trying to educate children, trying to find ways to encourage them in entrepreneurial activities, but we're also trying to sensitize the host community around.
And of course, with migrant communities, we understand that there are a lot of disadvantages. People take advantage of them in all literal and emotional and every other sense you could think about. And we are trying to make sure that they are resourceful, that they don't feel like if their rights are taken advantage of. Whatever the reasons they end up in Trinidad and Tobago, it's not our business. We just want when they're here, they're comfortable, supported and protected.
These people are not a threat, they're an asset for the future, they're just citizens in need, and we are all citizens and we should help the citizens in need.
I'm a medical doctor. I'm here to render my services to the community here in Icacos.
This is my first time in Icacos, but usually we have the Henry Durant Clinic in Port of Spain every Thursday, and that would be between myself and the other doctors who volunteer with the Red Cross. And every month we try to do at least one outreach into different communities. I think it's very important to be able to give access to free healthcare to these individuals who otherwise would find it extremely difficult.
They don't get full service here in Trinidad, only in emergency care.
I would highly recommend doctors to get involved with things like this.
It opens your eyes to what is going on.
And if you can volunteer, even if it's just one day a month, it'll make a huge difference to all the vulnerable populations.
So really I take my time today to thank the volunteers of the Red Cross, the United Nations and all the other actors involved who helped to bring this event together.
We hope to continue this work with the Red Cross, but other organizations in Trinidad and Tobago, not only in terms of migrant, but in all other human rights areas.
We'll be back. We've been back to this community 4 times already for the year, and over the next year, every 3 months, we'll be visiting them, seeing how their water situation is improving and how their culture is changing as they improve their hygiene situation.